Hi, I'm Tabia Akintobi, Professor and Chair of the Department of Community Health and Preventive Medicine at Morehouse School of Medicine. I am thrilled to announce the release of a book I co-edited and co-authored with partners and leaders across the country called Community-Centered Public Health. It's designed to equip learners and leaders with the tools that they need to know the strengths, challenges, as well as the opportunities to advancing public health programs that matter. Every chapter is aligned with key public health competencies. But what's really special about this text is that every chapter is also co-authored by a community leader as well as a former student, providing key insights central to ensuring community wisdom, as well as innovation from former students who have learned what they've missed and want to ensure that the next generation of health professionals get the best in how they are prepared to advance healthier communities locally and globally. This text is broken into two sections that cover the principles of community-centered public health as well as applications. In the principles section, folks will learn about the importance of context and culture, how to establish community governance rather than advice in public health programs and research, as well as important community engaged research strategies. In the application, folks who are in policy, who are interested in clinical care, translational research, community-based participatory research, public health preparedness, as well as health communications and health policy will all find themselves in this text. I'm super excited about the last chapter, which really focuses on the key values and beliefs that will prepare the next generation of health professionals to be prepared for how to engage in community research, practice, and policy that makes a difference. What makes this book great is its focus on integrating the community wisdom, the public health expertise, and lessons learned across each of those lenses. We have folks from academic institutions, from community-based organizations, as well as others in the broader community, all that have a stake in advancing community health, bringing their lenses to this. I'm particularly proud that within each chapter, learners as well as educators and leaders will actually have video reflections from practitioners and community leaders who have addressed public health issues, not sugarcoating the challenges, but talking about the highlights, the lowlights, as well as lessons learned in working together to address health policy, to develop health communication strategies, and to implement research that matters and makes a difference. The lessons learned, the challenges in doing it well. We are very clear that trust and trustworthiness is built over time, and it takes challenges, triumphs, as well as lessons learned in collaboration. This text provides all of that. It provides real-time videos as well as pedagogy that we know must work together. We hear that community engagement is important, but we don't get the details on how to do it. We don't have exemplars in the community as well as in the academy or in public health that unpack their own lessons learned in failing in advancing evidence-based practice to conduct research and advance public health that matters. This text really fills that gap. It provides strategies, applications, models, and tools that people can use based on real lessons learned in advancing public health strategies that matter. People can get a copy of this book by going to Springer Publishers or Amazon.com.